I'm entering the experimental psychology program at Ottawa in Montreal. So this is a combined MA PhD program. My co-author, Angela Boland, is in the same laboratory as me in the same experimental psychology program. I'm here with my other co-author, William, who's entering the religious studies MA at the University of Ottawa. And then my supervisor, Dr. Andra Smith, has a background in neuroscience, mindfulness, and substance use. So I'm primarily presenting the findings of my honors thesis project, which was conducted over last academic year, as well as some preliminary findings from my dissertation work that we just started. Young people experience many stressors and have found variable methods to deal with them. Some, but certainly not an exhaustive list, include mindfulness, substance use, religiosity, and dissociation. Importantly, each of these can involve an altered state of consciousness, and few studies have examined all of these variables together, how they impact well-being. Altered states of consciousness broadly encompass alterations in subjective experience that differ from normal waking states, and may include changes to affect, bodily awareness, and perception of time. Altered states of consciousness are a broad category and can occur within and outside of religious practice, and these experiences will vary in how they relate to well-being and their efficacy to reduce stress. Mindfulness is defined by the cognitive ability to be attentive to the present moment without judgment, and has been highlighted in recent literature as a valuable stress reduction technique. Mindfulness practices can be found in both religious and non-religious contexts. Breathing exercises, intentional attunement to the present moment, and physical movement. But utilizing mindfulness practices can result in a positive and enduring altered state of mindfulness. The relationship between well-being and mindfulness has been well established, and as a result, a variety of interventions for mental and physical health make use of mindfulness training. And while mindfulness has been previously recommended as a potential treatment for dissociation, limitations may arise for some populations in utilizing these techniques. For example, while high attentiveness to the present moment, which is an aspect of mindfulness, is consistently associated with well-being among meditators, it has also been identified as a potential risk factor for pathology following the experience of a traumatic event. Additionally, for individuals who have high dissociative tendencies following a traumatic event, attempting mindfulness exercises may cause distress rather than improvement. And, so if someone, has a lot of distress that they haven't necessarily processed, these exercises that cause an attunement to those feelings and they bring up a lot of the stress, and this might be overwhelmed. This may be part of the broader healing process. It may be too much for them all at once, especially if the mindfulness practices they're engaging in are their only form of support. And this consideration may be of a special importance for individuals who have previously been involved in cultic or high control groups, as therapeutic interventions that resemble practices of the group could serve as a trigger. Further research is needed to determine the applicability of mindfulness intervention among certain groups, and sensitivity is needed when utilizing them with patients that have had traumatic experiences or who have significant dissociative tendencies. So dissociation is a complex phenomenon characterized by a disruption or discontinuity in the normal integration between internal processes. Dissociative symptoms are expressed as unbidden intrusions into awareness of behavior, with accompanying losses of continuity in subjective experience, which can contribute to an altered state of consciousness. Dissociation can be utilized as a way of escaping from highly distressing overexperience, and as a result, it is often associated with trauma-related altered states of consciousness. However, the relationship between dissociation and well-being is complex and deserves further exploration, especially within the context of religious practice. And to give example, for example, meditation, on the outside may seem strictly a mindfulness practice, because you're, focusing on bodily sensations. However, in some cases, the goal of meditation may be have a more out-of-body experience, which we would then associate with dissociation. So it's not always clear whether or not a practice on the outside is a mindfulness one or a more dissociative. Religiosity is the extent to which a person commits themselves to a particular religion. This can include ideology, intellect, and as well as public and private practice. So higher religiosity is typically associated with higher well-being However, previous studies have been limited in their ability to generalize this outside of specific demographics. For example, factors such as having a minority sexual orientation or identifying as non-religious results in a much more complex relationship between religiosity and well-being. While it has been documented that religious experience can result in a positive altered state of consciousness, variations in religious practice mean that the cause of these are heterogeneous. Additionally, while religiosity has been shown to have a moderate correlation to well-being, negative experiences of religiosity, such as spiritual crisis, may more strongly predict low mental well-being. It also remains unclear whether heightened religiosity predicts well-being following disaffiliation from a cultic or high-control group, so a better understanding of religiosity and its correlates are needed when we are talking about cults. Lastly, another strategy that people may use to cope with stress is substance use. Alcohol and cannabis in particular are frequently used by young people, and both can have detrimental effects on mental and physical health depending on the quantity and frequency at which they are consumed. An additional consideration that should be made is the impact of religion, as religious affiliation can have an influence on patterns of abuse. Specifically, the acceptability of alcohol use within a religious community has been shown to influence the prevalence at which it is abused among adherents. And in some cases, this may be a protective factor against substance use. However, experiencing turmoil regarding religious affiliation and experience can also predict problematic substance use. So I want to spend a bit of time talking about how we measure religion is affiliation in largely a quantitative context. So my research background is in psychology with a little bit of religious studies influence as well. And so religion is an incredibly diverse and integral part of culture, but it has been missing from consideration or inadequately measured in much of the literature. So when religion is taken into account, it is often measured in terms of frequency of practice rather than by particular affiliation. And measuring religious affiliation based on participation in religious practice carries the assumption that all persons who engage in religious activities identify as religious, which is not necessarily the case. And although individuals may share a congregational space, those who attend service and then leave will not necessarily be affected in the same way as members who are full-time involved in a community. Furthermore, given that religious practice can vary dramatically across different religious groups, inquiry into how religion can influence altered states of consciousness may need to measure religious affiliation in order to avoid inaccurately generalizing findings cross-culturally. Currently, it is very common for studies that include religion as a variable to simply ask the participant to indicate if they are religious, without the ability to elaborate on their particular affiliation. And to understand religion as a component of culture, especially when comparing ordinary religious involvement around cult involvement, it is also important that we measure the impact of religion in those beyond current affiliation. So former members of both major religious traditions and those of cultic and high control groups, this previous affiliation may still be a very significant. But since virtually all studies that include religion as a variable only measure current religious affiliation, we are missing significant data in the literature at the frequency at which people are involved in and leaving cults. Furthermore, we suggest that examining the religious affiliation of individuals' parents may also provide input into culture and identity. Religious disaffiliation can be an emotionally difficult process that impacts a person's well-being, and family influence and affiliation may impact how and when this change in identity unfolds. Incongruence between religious affiliation of an individual and their family may be especially significant for young adults who are at a crucial point of gaining independence and forming identity. Importantly, when a group places high importance on conformity and community, the perceived and genuine costs of disaffiliation may be much higher. In summary, religious affiliation, although neglected in many previous studies, is incredibly relevant, and there is a need for it to be adequately measured in order to incorporate it into demographic considerations. And we believe this incorporation of religious affiliation broadly can help us bridge the gap between cultic studies and broader data sets. So for my honors thesis project, we were confined by the limits of an undergraduate research project in how many variables we were going to consider. But our main objectives were to examine how each of the variables that I've outlined related to altered states of consciousness in turn relate to well-being, and to compare these scores by both current and past religious affiliation. We also wanted to examine how questionnaire scores varied by this parent-participant relationship to see if a conflict between the participants' affiliation and that of their parents helped explain these variations in well-being even more. And for my second study, which is still ongoing, we have the additional objectives to compare experience of disaffiliation for major religious versus cultic and high control affiliations, and overall to show a way to improve the measurement of religious affiliation broadly in future studies. We also wanted to illustrate the frequency at which students are involved in cultic and high control groups by trying to compare our already gathered student set to our community samples. So overall, we predicted that mindfulness would be correlated with lower dissociation, lower drug use, and higher well-being, as found in previous literature. We also predicted that religiosity overall would be related to higher mindfulness, but that this relationship would differ by affiliation. And we predicted that parent-participant affiliation incongruence, so when there was a mismatch between a participant's current identity and that of their parents, that we would see higher rates of dissociation and lower well-being. So for our first study, our student sample was recruited through the Inspire Laboratory at the University of Ottawa. So this is a data set of students currently enrolled in the Psychology 1101 and Psychology 1102 courses at the university. So as part of their class credit, they have to participate in a certain number of studies that are being conducted at the university. So they were able to choose from a list of studies they were eligible for, including ours. In addition to being enrolled in these courses, they had to be able to read and write in English and have access to a device they could complete our online survey on, be located in Canada, and be within the age range of 17 to 35. And in total, we had a participant pool of 833 following data cleaning. And this represents about 30% of all students who are currently enrolled in those courses. So it was very popular among the undergraduate students. And because we have such a large portion of the pool of undergrads, we believe that we have a pretty representative sample of those who are undergraduates at the U Ottawa. And just to go over like our measures, we had a measure for religiosity, one for mindfulness, dissociation, mental well-being, as well as cannabis use and alcohol use. For our second study, as I mentioned, recruitment is still ongoing, but we have a community sample recruited through the Inspire Laboratory. And these are participants generally within the Ottawa area, but they just have to be located in Canada. And these are simply individuals in the community who are interested in participating in research. So if they can sign up to be considered for studies that are open to the public at the university. We also recruited from the ICSA and occult mailing lists. So we currently have a few participants from there as well. And these participants, we specifically asked that they identify as a former member of a cultic or high control group. And for that group of former members, they did not have to be located in Canada, but they still had to be comfortable responding to the survey in English and have access to a device where they could do the survey. And to try and limit the potential for age effects, we did restrict our criteria to the 17 to 35 age range. So in total, we have 56 participants from this pool so far. And in addition to the demographic considerations and our measures for the previous study, we also asked them to self-identify whether they were a former member of a cultic or high control group. So to get an idea of the demographics of our students, these were mostly cisgendered white women, largely in their first year of university education. Many were heterosexual orientation, and about half were 18 years of age. Of those who are currently religious, that was, just over half of our sample. And whether or not participants were religious, the vast majority had the same affiliation as their parents. And while we didn't collect data on self-identifying as a former member of a cultic and high control group, we did note that 1.3% of respondents were currently a member of what we identified as a high demand religion, and 0.8% were formerly a member of a high demand religion. And this term, it's somewhat subjective. However, we are using it as a term to describe affiliations that we saw in the data set that have been previously identified in the literature as being high demand religions. And we think that this is a fairly conservative estimate of who's involved in these groups, as people don't necessarily have a specific label attached to the group they were involved in. So, like, for example, if a participant simply put their past affiliation as Christian, we don't know what denomination that was, or if that would have been a coercive or high control environment. But overall, this gives an idea that it was a substantial minority of the student data set at the very least. And I should mention our demographics were very similar for the community pool as well. Although those who had a gender minority, so those who were not cisgender, were overrepresented among our former members. And overall, in the communities set, participants did tend to be a bit older. And just to break down the relationship between parent and participant affiliation a bit more, as you can see, whether or not they were currently religious, the majority had the same affiliation as their parents. And our minority in this sample is those who were currently religious, but had non-religious or parents of a different affiliation. And this is interesting because this is representing perhaps like a religion that the participants have found for themselves, not one that was, I guess, handed to them culturally. And among our community sample, we have a fairly similar distribution. However, our group of those who were currently non-religious and had religious parents group is a lot higher, a lot larger, I would say, because we are specifically oversampling former members of cultic and high control groups, and they tend to be currently non-religious. And we didn't have quite enough data to break out the relationships for past affiliation in our community pool. And I won't spend too much time on it for our student sample either, but I did want to point out that of our non-religious participants, many had the same past affiliation as their parents, implying that the family unit maybe stepped away from the same tradition around the same time, as well as our large percentage of those who previously had an affiliation which was the same as their parents' current affiliation. So we conducted Spearman's correlation and created a matrix between all of the variables to see how they were related to each other in the student sample. And of 15 possible relationships, we found 12 that reached significance. And I won't go through all of them, but I do want to point out that all of them were significantly related to well-being. So this was a positive correlation for mindfulness and religiosity, as expected, and a negative correlation for dissociation, alcohol use, and cannabis use. And dissociation, as well, was highly connected to the other variables, with this being a positive relationship between alcohol use and cannabis use, and a negative relationship between mindfulness and well-being, as expected. And while we didn't see a significant relationship between religiosity and dissociation in the entire sample, when we broke it up by affiliation, we did see a significant positive relationship for our currently non-religious participants. And while it has been established in the literature that having a high degree of religiosity while being disaffiliated or non-religious in identity may predict like low mental well-being or higher rates of depression, to our knowledge, this is the first study that has made a correlational link between dissociation and religiosity among non-religious adherents. And we didn't see any significant relationships with religiosity and the other variables within our community samples. But over all three groups, we did see a significant relationships between mindfulness, dissociation, and well-being scores. So as you can see here, so we broke up the community pool by whether or not they identified as a former member. And we see similar patterns, especially, or quite similar, between our student sample and the broader community. We're seeing the correlations are going in the same direction and are roughly the same strength. However, among our former members, we're seeing the strength is much higher. So for context, the Spearman's correlation ranges from 0 to 1. So as you can see here, like a 0.8 like correlation between mindfulness and well-being is quite strong. And while the conclusions we can draw from this are pretty limited because we do have a small data set at the moment, it may suggest that mindfulness and dissociation are even more important when we're talking about well-being among former members of Cultic and high control groups. So jumping back to our student sample, we compared mean differences in scores based off this parent and participant affiliation link. We broke it up into 4 groups, so considering non-religious and religious identity, as well as whether or not it was the same or different as the parents. So we saw a significant difference in mean scores, specifically between those who were currently religious with the same affiliation as their parents, and those who were non-religious with currently religious parents. So we're seeing that those who were non-religious but had religious parents had the lowest mean scores of mindfulness, and that this reached statistical significance. And we didn't have quite enough statistical power to see significance for our other variables. We do see a very similar but opposite pattern for dissociation, where these non-religious participants who have currently religious parents have the highest rates of dissociation. And this group is made up majorly by participants who did have a former affiliation, which was the same as their parents. And we're also seeing this inverse pattern for well-being. And as you can see, like the mean scores are pretty similar when we look just at religious versus non-religious, as well as same affiliation as parents versus different than parents. But we are seeing this like big difference when the relationship is different based off non-religious and religious. So yeah, I guess to reiterate, when it's the same affiliation as their parents, regardless of whether or not it's religious, we're not seeing a really big difference in well-being, but we are seeing this like gap in scores when we are taking into account that whether or not their affiliation is different from their parents as well. And another thing I want to put into context for our student sample is that these are mainly first-year university students who are 18 years old. So this may be representing very recent changes in religious affiliation, as this may be their first time living away from home, first time having physical distance from their parents. So we really aren't sure if these differences in scores related to well-being would last in long term after they've maybe had more time, or if it's potentially an age effect where it's simply affecting them more because they're so young and still figuring out their identity. Jumping back to our community samples, we did independent samples t-test to see how mean differences for each of the variables differed between those who were current versus, whether or not they were former members of a Cultic and high control group. So we saw significant mean differences for a few variables of interest. So to summarize, former members of Cultic on average had higher dissociation, higher cannabis use, and lower well-being. And we didn't see significant differences by parent-participant affiliation congruence. And we aren't sure if this is due to low statistical power, or if because this sample is a bit older, maybe they've had more time to become stable in their identity. So it may be that once people have, become more firm in who they are and how they identify, this influence of whether or not it conflicts with their parents' identity is just not affecting them as much. So implications of our research, we've highlighted a potential for increasing mindfulness among students and former cult members by showing how these variables related to well-being differ based off of disaffiliation and affiliation. And we've shown the role that disaffiliation has in the well-being of students. We've also highlighted an importance for including both past and current religious affiliation in cultural psychology research, which I think is really key when we're talking about bridging broader research data sets to Cultic studies. For future directions, both for my own research and others who are interested in this line of research, that qualitative exploration into culture, faith, and barriers to achieve mindfulness among former members is really key. As while we have a broad idea of how these variables relate to well-being, what we're missing is participants' own understanding as to how these things are related, as well as like the specific timing of how these symptoms may have come up. We also need further exploration of religiosity, dissociation, and mindfulness among non-religious samples. As a key limitation we have of much of the previous literature on religiosity as a construct is that we're looking at exclusively religious samples, which really doesn't tell us much about how religiosity on its own impacts well-being. We also need cross-sectional or longitudinal analysis to determine the relationship between religion, disaffiliation, and well-being in older samples, to see if these differences in well-being and altered states of consciousness are lasting long-term, or if they are, whether they are related to age or distance away from their previous affiliation. I can take any questions now.